My name is Dr. Mikhail Varshavsky, but most know me as Dr. Mike from my social media handles. I'm here to answer all of the top questions from Betches about COVID-19. To break down COVID-19, we have to start with the term coronavirus. Coronavirus is actually a type of virus that exists in nature in huge amounts. For example, the common cold is caused 30% of the time by a type of coronavirus. This new coronavirus that has started in Wuhan, China, and has found its way all across the world and has become a pandemic is a specific type of coronavirus called SARS-CoV-2. The disease that it causes is called COVID-19, how we call HIV the virus that causes AIDS, which is the actual disease. It gets spread into the air through respiratory droplets, meaning someone sneezes or coughs. These tiny aerosolized particles hang around in the air for a short period of time or directly land on your mucous membranes, which means your lips, nose, or eyes, and then they start to infect your body. The virus actually enters some of your cells, hijacks your cells' inner machinery to start making copies of itself, and then proliferates throughout your body. Now, your own body's immune system is creating all this inflammation to fight off this virus, whereby that inflammation can itself be deadly and harmful to your own system. That if you can hold your breath for 10 seconds, you don't have this virus, completely untrue. If you gargle with salt water, that will kill off the virus, not true. That if you drink every 15 minutes water, that will somehow prevent you from getting the virus. Look, staying well hydrated is important to your health, but every 15 minutes is not a rule that anyone has recommended. Also, there are some marketing companies that are out there trying to tout immune boosting products. Vitamins, minerals that will essentially cure, prevent, treat COVID-19. None of that exists. The French Ministry of Health recently came out and mentioned something about not taking ibuprofen. And they said we shouldn't be taking this because it actually makes the virus symptoms worse. That has not been proven to be the case in good quality controlled studies. WHO said that they're not telling people to stop taking it. Now, we don't know yet if by taking ibuprofen you develop worse symptoms, or because you happen to have worse symptoms, you're taking more ibuprofen. So if your doctor recommends taking ibuprofen, please do take it. If you're able to take Tylenol, that's always an option. First and foremost, you gotta wash your hands as often as possible. 20 seconds with soap and water, palms, the fingers, the backs of your hands. Alcohol-based hand sanitizer, that's at least 60% alcohol. And no, not with Tito's vodka. Staying home. There's individuals who may just have very light symptoms or no symptoms at all that can be spreaders of this virus. So staying home is incredibly important, even if you're not feeling sick. So avoid touching commonly touched objects, elevator buttons, door handles. If you're gonna be riding the subway, use a tissue to hold onto the rail. Touch it with your fingers. You're very likely to make contact with your face, thereby spreading the virus to your body. The incubation period of this virus is basically when the virus first affects your body to when you may start seeing symptoms. It seems to be around a 5-day mark. Even on day 4, when you're infected with this virus, you're not showing symptoms yet, you still can be spreading the virus. So the idea of social distancing applies to those who are healthy, not healthy, and everything in between. Because of the lack of testing kits and the availability of personal protection equipment for us doctors and nurses on the front lines, it's been really hard to get an accurate sense of how many people have been sick and are currently sick with COVID-19. Over the next 2 weeks, we're going to see the cases skyrocket. We don't know if these cases are skyrocketing because there's true community spread, or because we're just playing catch up and actually testing the people who already have been sick. If you live with someone who is actively going outside during this time, like myself, I'm a doctor, I'm still seeing patients, you have to make sure that when that person comes home, they're washing their hands. They're making sure that they stay 6 feet away from anybody on the train, on the subway. They're avoiding touching their face. Wear gloves. They don't have to be medical grade gloves. They can be leather gloves. Why? Because you're going to be making contact with solid surfaces, but then you're less likely to touch your face wearing a leather glove. Because in order for this virus to infect you, it can't just make contact with your skin. It has to make its way to your mucous membranes, which include the mouth, nose, or eyes. That being said, it's not a bad idea to take off the clothes that you were wearing outside, put them in the wash your hands, take a shower, and go that extra mile to keep your family safe. And make sure you turn it on high heat. It takes about 60 degrees Celsius in order to kill off this virus successfully, which is 140 degrees Fahrenheit. My recommendation has really been to limit those visits. People have said, what about children? Maybe they can have play dates. And I still wouldn't recommend that, because while the younger children under the age of 10 have been having milder cases of this virus, they can still spread it to the adults in the family. And a lot of adults are over the age of 60 and they potentially have the worst cases of these viruses. So we want to keep the entire family safe, limit the spread of this virus. I always recommend cooking at home because you're always going to make healthier options when you control the ingredients. If you're going to be ordering in, do it the smart way. A lot of these apps have no contact delivery. Make sure that you wash your hands immediately after unpacking the foods. And make sure when you eat the foods, you eat it with a fork that's from your own home, because you never know who put the fork in. Was it individually wrapped? Was it not? But generally speaking, because foods are cooked at above 140 degrees Fahrenheit, the virus should die inside the food, even if it was there to begin with. If you're going to be doing Tinder dating, make sure that you keep it virtual for the first few dates. Use FaceTime, use Skype, connect online like the good old days. Remember AIM, ICQ? There's no use risking your entire family's well-being simply because you want to get married at this specific point. You're going to lose money, possible deposit losses, but you're doing that to trade off for better health. The last thing you want to have happen is to have a happy wedding and then to have a family member get really sick and end up in the ICU. That also puts a huge strain on our hospital systems. And when we do that, we may run out of hospital beds if everyone gets sick at the same time. So please, weddings definitely fall under the category of social distancing. Nowhere has the CDC or WHO mentioned that we need to stock up on paper towels or toilet paper or anything like that. Sure, you should have medications lined up for at least a week or two. You should have some canned foods available in order to feed your family, bottled water, but all of that is still available. There's multiple ordering sites from Amazon to Thrive Market. Use those to get the products that you need at home. There's certainly silver lining in this situation for the amount of solidarity we're seeing in the United States. We're all coming together to practice social distancing in order to flatten the curve. There's been well over 80,000 recoveries in the world with this virus, which is a really good sign. Clinical trials are ongoing for medications to treat or shorten the duration of this virus, and some of them are showing very promising results. Chloroquine, which is an anti-malarial medication, and remdesivir, which is an anti-Ebola medication. It's an antiviral. Both are showing really good promise. In fact, the medication remdesivir is being used in a compassionate use basis, meaning that if a patient's really sick, even though it's still under experimentation, we are using it, and again, seeing promising results. So my hope is that within the next month or two, we should have a medication that's FDA approved to treat or at least shorten the duration of this virus, which can bring it into a more manageable state, much like we do with the flu and a medication known as oseltamivir. If you're having mild symptoms, the recommendation is to contact your family medicine provider. If you start experiencing worse symptoms, head to an ER. However, you have to contact the ER first so they can get all the other patients out of the way, give you the exact steps of how to bring yourself in without infecting personnel at the hospital as well as the patients that are there in the waiting room. Thanks so much, guys, for watching my little Q&A on COVID-19. If you want to get more information about this virus, get some updates every single week, check out my YouTube channel, Dr. Mike. And remember, the slogan that I want you to have: alert, not anxious.